How braces work. How does orthodontic braces straighten your teeth and gain other results? The simplest function of braces is usually from fixed braces, where a pressure is placed upon a tooth. And once a pressure is placed upon a tooth, the tooth slowly moves through the bone. The bone in front of the tooth dissolves and is reformed behind the tooth, meaning that in effect the tooth gently moves through the bone. The most effective is if this force can be applied fairly consistently to allow the gentle progression of the tooth through the bone. Forces going in different directions at different times can cause some problems with this process. As a general rule, the bone reforms perfectly behind the tooth. And as a general rule, the tooth does not dissolve, but usually a little bit of the tooth dissolves, and the tooth is not as dynamic as bone. Subsequently, the tooth is usually a little shorter and smaller, or the root of it is, once it's completed its journey. There are some other methods of orthodontic effect. One of these is functional appliances. Functional appliances are removable appliances, usually, worn in the mouth so that when you bite together, when you bring your teeth together, the teeth are forced into a new and different position. The concept behind this is that if you function into a new position, eventually you will grow into that new position. They can be very effective with some people who have good muscle tone and who are susceptible to being guided to a new position. And they tend to be less effective in people with weak muscle tone who are resistant to being guided into a new position. And finally, there are postural appliances. These are used to change where people posture. For it is thought by some people that function is too short an effect. It doesn't last long enough. And you need to move people so that when they bite together, they stay biting together in this position, because the appliance touches their skin, reminding them to hold themselves in this position, following the concept that your jaw or any bone will grow into the position where it is held for most of the time.